everyone. Welcome back to Arthritis Broadcast Network as we are streaming live from the CRA conference. I'm so happy to have Clayon Hamilton here with me today. He's a postdoctorate fellow at UBC. Thank you so much for joining us.
Thank you for having me.
So could you tell us a bit about yourself, how you're involved in rheumatology?
Well, I did my master's and PhD, which was focused on early recognition of knee osteoarthritis.
Okay.
So those early sort of osteoarthritis pain, we sort of looked to see how we could, based on the way people responding to their pain, whether we can use that as early indicators to say prevent activity limitations and so on, so that they can hopefully have a better trajectory over the years for their osteoarthritis in their knees.
And how did you choose that subject area?
I kind of just fell into it.
Okay.
Yes. When I just moved to Canada in 2007, I sort of was looking for volunteer opportunities, and it so happened I went to the physical therapy department at Western, a university in London, Ontario, and I spoke with someone at the department, and they directed me to Dr. Birchesworth, who was doing research in the area at that time, and so I started on first volunteered with him, and one thing led to another, and I did my master's with him, and I did my PhD, and the main focus was looking on ways of measuring sort of the early recognition of knee osteoarthritis, and specifically I focused on behavioral change, illness perception, and behavior.
Okay. Yeah. Interesting. So the research that Clayon is doing right now is really important, especially being a patient. I think that it's really meaningful. Could you tell us a bit about it?
Yeah, so right now my focus is on measuring meaningful patient engagement in research. So this is where patients are involved in research not as participants, but as members of the research team, members of advisory boards, of grant review panels, and so on, so that their input can be integrated throughout the research process. And the idea is that this will improve the quality of research. Definitely it would add relevance to the research so that it reflects the preference and needs of patients. Yes, and so the ultimate aim is that it will improve the impact of research on sort of the healthcare system and the health of patients. Yeah. And so that's where my focus is now. But specifically at the moment, I'm looking at measuring meaningful patient engagement in research. So we know that patients are being engaged in research, but what is the quality of that patient-researcher partnership? Are patient being valued? Are they feeling valued when they engage in this research? Are they being supported throughout the process of engagement? We hear a lot patients are saying they feel more tokenistic, like their engagement. So
just to have the poster face to show that they're being there, but then not actually being involved in the research.
Exactly, they feel like their voice is not being heard, even though they're in the room, and sometimes their voice is not being solicited. So how can we have a engagement in a way that the patient voice is heard and the patient voice is integrated in the decision making? And
okay, well, I mean, I know that you're doing this with ARC, with Arthritis Research Canada, but of course this applies to so much more than just arthritis. Is that correct?
Yes. So the research that I'm presently doing, it has implication broader than just arthritis. I do work with arthritis patients who are part of the research team I'm on. We have 4 patient partners, all of whom have arthritis, but the research, the participants in our research come from all disease groups, really, and so the research that we're doing is applicable to basically everything.
Yeah.
And so the questionnaire, when it's done, it will be able to be used to assess meaningful patient engagement in a broader population.
Yeah, absolutely. So for being a patient myself and for other patients, if they wanted to get involved in research, how could they go about doing that?
If they wanted to be sort of engaged as a member of the research team, there are more and more opportunities for patients to be engaged. I know at the UBC there are different research teams. At University of British Columbia, there are different research teams that are always looking for patients to be involved, but of course sometimes it's specific to disease groups. And there is the Patient Voices Network that sometimes advertises opportunities for patients to be involved. There's now the patient support, the sport support unit in BC, where they have many different opportunities that where the researchers contacted the BC support unit for help with their research and how to sort of engage patients in research. They focus specifically on patient-oriented research, and one of the sort of principles around patient-oriented research is that patients are involved as partners. And so basically most research that is being done now, the future or the preferred way of going about doing it is by involving patients. So many research teams are out there. It's just for patients to sort of reach out or for researchers to reach out to the patients.
Yeah. So are researchers pretty enthusiastic about involving patients in their research as partners?
I think many researchers are enthusiastic, yes, but there are always some that are questioning whether this is the right way to go about doing it.
Well, hopefully from your research they can see, all the benefits that it provides and how it can lead to much more meaningful research.
Definitely, that it can lead to more quality research that has an impact on sort of moving the healthcare system forward and the care of patients.
Absolutely. So what have you found most interesting this year at the conference? You had an opportunity to sort of go to some presentations or see other posters.
I found it very interesting, the new developments around the use of cannabis to treat. It seems for the anecdotal evidence that's out there is that it has been very effective in terms of for pain for people with arthritis. So over the coming years, with this new legislation to make the use of recreational marijuana legal, I think it's going to be very interesting to see sort of more research being done in the area and how it will change the way the care for patients with
chronic pain.
Chronic pain.
Yeah. And so for yourself, do you have any sort of aspirations career-wise in the field of rheumatology or beyond?
In terms not specifically focused on rheumatology, but sort of more the broader field of health services, I want to definitely move the field of patient engagement forward, where the voice of patients are integrated throughout the entire process, and that it's not done in a way that it's the researcher or policymakers that are leading sort of the way things are done and are making all of the decisions, but that it's a truly partnership. It's a true partnership where the voice of patients and the voice of the other leaders are integrated, and what we get out of it is reflective of that.
Exactly, reflective of what actually matters to the patients.
Yeah.
And, Well, Anita, do we have any questions from our audience?
From a researcher's point of view, how can you make research papers more patient-friendly and engaging?
Just through my limited experience so far, working with patient partners, one of a very good contribution that they've made is sort of making the language more lay friendly.
Yeah.
And so some of the words that I would, based on my reading, I would put into the papers to kind of carry on that sort of researcher-oriented way of writing things. Having patient partners on the team have kind of changed that and kind of also make it a bit more ethical, the language. So it's not talking down to patients, but it's actually showing in a way that I value the voice of the audience, of who the knowledge user, and I value the voice of the subjects of the
and that they're more
the
than
paper.
just subjects.
Yeah,
right?
they're more than just subjects, but they're definitely, in a way, partners. So the paper is not from a researcher point of view where they're looking definitely participants as subjects, but they're looking at them as we are working together, we are in this together. This is what I have to share with you, and hopefully it makes a difference. Yeah.
So the patients, the patient partners in research, they help also in the writing of the research papers, or give sort of their input. It sounds like what you're saying.
That's definitely what I'm saying. Yeah.
Yeah, and then, it makes it more accessible for patients. If I know for myself, sometimes I'll come across these really fascinating studies, but then when I try to read them, it just, it goes over my head, all the scientific language, and it ends up actually, even if it's super valuable information, it might not actually get back to the patients who could really use this information because of the way it's presented. So.
Exactly, yeah.
Great.
You hit the nail on the head right there.
Any more questions, Anita? Well, Clayon, thank you so much. The research you are doing is very, very meaningful to myself, and I'm sure to many of our viewers.
Thank you very much for having me, Maya.